Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician. Though I am a specialist in endocrinology, I help people with obesity. So you can see this. Can you see the scenery? This is what my patient could see the last month, but now I've just come across 6 of my patients who sadly cannot see them. So you'll be wondering, why is that? Well, you know that obesity could cause type 2 diabetes, high blood pressure, stroke, heart attack. We all know that. But did you know that there are 10 different causes for blindness just because you're overweight or obese? So that's what I'm going to talk to you about today. And the fact that you are aware of this, that helps you prevent these conditions happening. So the first one is diabetic retinopathy. I'm sure you know that people with obesity have diabetes are more prone to get type 2 diabetes. And if the diabetes is not properly treated, they can develop complications in the eye, and that is called diabetic retinopathy. This is why people with type 2 diabetes or diabetes have a yearly check and have retinal screening every year, so that if there's any problems picked up, they can have prompt treatment like laser. So that's the first reason, is diabetic retinopathy. The second reason is hypertensive retinopathy. So people with obesity can have high blood pressure. So, and that, if not treated, if the blood pressure is not treated, the high blood pressure can cause problems in the eyes, mainly in the retina, and that can lead to blindness eventually. So that's the second cause, hypertensive retinopathy. So the third reason is glaucoma. I don't know if you have heard of glaucoma. Glaucoma is a condition where there is increased intraocular pressure. There are several different types of glaucoma, which is open-angle glaucoma or a closed-angle glaucoma. As I said, I'm an endocrinologist and not an eye specialist, so I won't go into the details of these conditions, but I'm going to just increase your awareness so that you can seek help from an eye specialist. So with obesity, there is increased intraocular pressure, there is pressure within the eye, and that can lead to blindness if not treated well. People usually complain of fuzzy vision, they have pain, and they're watering of the eyes. So if you have any of these, you should quickly see your optician and then an eye specialist. So that's the third reason, which is glaucoma. The fourth reason why someone with obesity can get blindness is increased intracranial pressure. So this is not blood pressure. This is pressure within the brain. That's called intracranial hypertension. So people complain of headaches. They have headaches when they move their head. And what we normally do is we refer them to our neurology colleagues. They do a lumbar puncture. And when they do the lumbar puncture, they check the pressure with a manometer. If the pressure is too high, they allow some of the cerebrospinal fluid out. So the treatment is usually having regular drainage of the cerebrospinal fluid by doing a lumbar puncture. So that's the treatment. So, but if you don't treat intracranial hypertension properly, that can lead to blindness. The optic nerve, the nerve which supplies the eye, that can get damaged. So this is quite common in people with obesity. So obesity can cause intracranial hypertension. Intracranial hypertension can lead to blindness. So that's the fourth cause. The fifth reason is stroke. As you all know that people with obesity can have heart attack and stroke. And what does stroke mean? Stroke means loss of blood supply to a certain portion of the brain. So if there is a loss of blood supply to the back of the brain, especially the occipital lobe, then people can get blindness, because occipital lobe is the area of the brain which controls our vision. So obesity, as you can clearly see, causes hypertension, and if not controlled, can lead to stroke. And then if the stroke affects the occipital lobe, that can lead to blindness. So that's the fifth reason, stroke leading to blindness. The sixth reason is floppy eyelid syndrome. I don't know if you have heard of this, but I do see in my patients, especially those with obesity and sleep apnea. What is sleep apnea or obstructive sleep apnea? Is a condition where when people are sleeping for a few seconds, the brain doesn't get enough oxygen. So they're snoring, and suddenly the snoring stops. Then they start, and again they start to breathe or snore. So, and this can happen several times in an hour. So throughout the night, They're having split seconds when the brain is not getting enough oxygen. And that can lead to lots of problems. That can lead to tiredness, high blood pressure, type 2 diabetes, right heart failure. So there are loads of conditions if sleep apnea is properly treated. And the treatment is usually something called CPAP, continuous positive airway pressure, which is a mask attached to a machine. But in this group of people who have sleep apnea, what I find is, and obesity, what I find is the eyelid usually starts getting floppy, especially the top bit, this way, or the bottom bit, some very rarely even the bottom bit. So the eyelid is turned. The reason people say, that my eye specialist colleagues say, is whenever there is an increase in oxygen and lack of oxygen, the eyelids is usually elastic, and that it loses this elasticity and starts to become like this. So this is called floppy eyelid syndrome. And this is what I see in my patients with obesity and sleep apnea. So that's the sixth cause. The seventh reason for blindness is dry eye syndrome. So what happens is that the eyes are dry and is more common in people with obesity, and if untreated can lead to problems with the eye. So it's easy to treat if you have artificial tears, but I would always advise my patients to go to an eye specialist. The eighth reason is cataract. Cataract is a common condition which you must have heard of, where the lens in the eye becomes cloudy. When the cataract is mature, it's white. And the treatment is straightforward. The lens which is cloudy is removed and you can have an artificial lens put in. And this is more common in people with obesity. So obesity can actually accelerate the process of cloudiness within the lens. And if not treated, you can't see. You can't see anything because the lens is very cloudy. So that's the eighth cause. The ninth cause of blindness in people with obesity is retinal vein occlusion. So obesity can, as I said, cause high blood pressure, can cause diabetes, can increase the cholesterol level. All these conditions increase the stickiness of the blood within the blood vessels. So when the blood is sticky, that can lead to clot. And when there's clot, there's loss of blood supply to the back of the eye. That's the retina. So that's called retinal vein occlusion. You may complain of a portion of the visual field being obstructed. So that's usually the symptoms, where one patch you can't see. So you should promptly or immediately go and see your eye specialist if you think that you can't see one area of your visual field. So that's retinal vein occlusion, which is the ninth cause. The 10th and the most serious one is called macular degeneration. Macula is the main area of the back of the eye, which controls the vision. If you've got problems with the macula, you can't see anything. So age-related macular degeneration is a common condition for blindness. And people with obesity, this whole process is accelerated. So it's very, very important to go and have regular reviews. So I've mentioned 10 different causes of blindness. I can just elicit quickly: diabetic retinopathy, hypertensive retinopathy, glaucoma, intracranial hypertension, stroke leading to blindness, floppy eye syndrome, dry eye disease, cataract, retinal vein occlusion, and the 10th is macular degeneration. Okay, so you learned about 10 different causes of problems with the eye. But then I also see in my patients with obesity, most of them are short-sighted. What do you mean by short-sighted? That means they can see near, things which are near, but they can't see the things which are far. So that's called short-sighted. Usually, that's also the medical term is myopia. But now we have started to learn, the science is showing that people who have got more adipose tissue or fat tissue, they can become myopic. That is, become short-sighted. So can you see that? Obesity, high fat, causing myopia, short-sightedness. So just having short-sightedness, people would think, well, that's fine. I may just put on a lens and I may get going. But the problem is, people with myopia are more prone for retinal tear, which is a serious condition. So I advise all my patients with obesity to have yearly checks by their optician or by their eye specialist. So my diabetes patient, they as a rule go and have yearly checks. But now I have started to tell my patients with obesity to have yearly checks so as to prevent blindness. So what can we do? Well, you know that we can help people with weight loss, but weight loss is not just eating less and exercising more. There's lots of things involved. It should be very personalized to them because it's becoming such a serious topic. 1 billion people in the world are obese. Now, Semaglutide or Ozempic, which is the brand name for diabetes, and Wegovy, which is the same Semaglutide, which is licensed for obesity. There's a research going on to look into people with obesity, whether semaglutide can prevent blindness. So the study is called FOCUS, F-O-C-U-S. The results will be released in 2027. So I'm just giving you a snapshot of what the research is going on. So it's so important that the drug companies are investing their money to prevent blindness. So semaglutide is being trialed now to see if blindness can be reduced in people with obesity. I just want to digress. If you have got diabetes and if you've got diabetic retinopathy, I would advise you to tell your doctor about that because it's not supposed to be given. Ozempic or Wegovy should not be given in people with diabetic retinopathy or any form of retinopathy, as it may worsen it. The reason it worsens is it sometimes stimulates a hormone called vascular endothelial growth factor. It stimulates the growth factor and may worsen it in the short run. Another thing to just highlight is if you've got diabetic retinopathy, don't go for Ozempic or semaglutide. Please let your doctor know. Okay, hope I've made things clear that obesity and blindness is closely correlated. As I said, this is an educational video and it's very important to go and see your eye specialist. If you need any other topics related to obesity, please do let me know and I will endeavor to bring up this topic because obesity is so common now. There are lots of associated medical conditions. Thank you.